common issues that we see in the pediatric setting, sore throat, pharyngitis, we see that often. Viral versus bacterial versus allergic versus mono. So I have a little chart here. Let's talk about the viral first. Generally caused by adenovirus. The patient will complain of hoarseness, some coughs. They'll complain of some headaches, just being fatigued, malaise, may or may not have a fever, maybe a low-grade fever. Upon examination, you will see the erythema may be redness in the throat, maybe some ulceration in the posterior pharynx. The other cause of sore throat is bacterial, acute bacterial pharyngitis. The most common cause is strep. Typically, we see this more commonly in 5 to 13-year-olds. It's typically an abrupt onset without any nasal symptoms. Sometimes the child might complain of some throat joint pains, some myalgias and headaches. They may have moderate to high fever, malaise, sore throat. This is typically more common in the late winter and early spring. Physical exam finding, you will see erythema and white or yellow exudate on the tonsils and or pharynx. Anterior cervical chain can be enlarged or tender. And at times there are no other URI symptoms. Upon examination, there's also this bad breath. And sometimes you might see petechiae on the soft palate and the pharynx. And swollen beefy red uvula along with the enlarged tonsils. The next one I want to talk about is allergic pharyngitis, typically sore throat, itchy, persistent. That sore throat that can linger on for a few weeks and returns frequently. A patient might complain of postnasal drip, sneezing, along with a sore throat. Upon physical exam, you may see some erythema in the tonsils and some cobblestone changes in the throat area. The other disease to consider with sore throat pharyngitis, pediatric population, is infectious mono. Typically caused by Epstein-Barr virus in more than 90% of the cases. Clinical finding, you also have sore throat, malaise, fever, headache. Typically, there are 3 phases that can occur: the prodrome, acute, and resolution. In the prodrome stage, the symptoms are really mild, such as malaise, fatigue, and maybe a low-grade fever. In the acute, you'll see the classic symptoms of high fever, sore throat, malaise, fatigue. Sometimes upon physical exam, you might see some hepato or splenomegaly and a rash. And the third phase is the resolution. Gradual decrease of fatigue and fever, organomegaly. And when they are at the resolution phase, it can take 1 to 2 months to resolve. So when you have a patient with sore throat pharyngitis, these are the differentials you need to consider. Obviously, some diagnostic to order would be COVID-19, a rapid strep, and a monospot. Treatment for viral, symptomatic treatment. For the bacterial, for the strep, NVK. Again, try to dose it where it's a BID so it's easier for the kid. If they're allergic to penicillin, there's Flex, and then supportive care. Make sure you teach the parents that to change the toothbrush, the bathroom cups, any dental appliances, to minimize, so just to reiterate, change the toothbrush to cups, any dental appliances, just so that you're getting rid of these tools that might still have the strep, the bacteria in it. So fresh, clean toothbrush is important. For the allergic, symptomatic care, if they're having a lot of postnasal drip, use saline spray, Flonase, if it's not contraindicated, antihistamine if they are of age and they can take antihistamine, and symptomatic care for allergies as well. Remove the allergens in the house. Mono, the management for that is just supportive treatment, adequate bed rest, OTC pain relievers, fluids. With all of these, you want to make sure that the child hydrates. For the mono, it can take 2 to 4 weeks to resolve, and the fatigue and weakness can last 6 to 12 months. So just some images here for you guys to look at the difference. This is the strep pharyngitis, the viral pharyngitis, and here the allergic. You can see the cobblestone here into the back, and then the mono. Centor scoring or modified Centor scoring is a really good tool to have to determine whether someone with a sore throat needs to have a rapid strep or needs to be treated empirically. Just hang on, I wanted to just to zoom in on this. So as you can see, this is a really good algorithm to use to determine whether this person might have strep and or rather determine whether you need to order a rapid strep. This should be in your reading, so review it. It's a good tool to have to understand when you